Our topic today is nutrition for post-stroke patients. So, how does the patient's digestive system change after a stroke? And what health issues can these changes lead to, specifically regarding the digestive tract of post-stroke survivors? First of all, stroke patients, aside from brain-related issues, naturally face digestive problems. The first issue people often notice is difficulty swallowing, dysphagia, and frequent choking. Cases involving choking or difficulty swallowing will lead to: first, the ability to tolerate food in the intestinal tract becomes very difficult. Second, when eating, the patient is prone to choking on food. Subsequently, when food reaches the lower intestinal tract, the patient is prone to symptoms of constipation, indigestion, or even diarrhea. Third, after a stroke, doctors usually prescribe medications to prevent future strokes. These medications can sometimes cause gastrointestinal bleeding. These are very severe complications in post-stroke patients. So, if cared for properly, can the digestive tract of a stroke patient return to normal? The digestive tract is controlled primarily by the autonomic nervous system. In the initial period after a stroke, digestive disorders will occur. Later on, depending on the patient's constitution, age, underlying pre-existing conditions, and the severity of the recent stroke, the patient is fully capable of recovering digestive function. From a digestive perspective, how important is scientifically correct nutrition in restoring digestive functions and health after a stroke? Nutrition is the top priority for recovery and treatment. Stroke survivors have higher energy needs than the average person. It is necessary to build a scientific nutritional menu for stroke patients. You need to pay attention to the consistency, thickness of the food, because post-stroke patients will experience indigestion and eating becomes very difficult. The amount of food consumed at one time should not be too much. Instead, it should be divided into multiple meals. This could be 5 to 6 meals a day, and each meal must still ensure a full range of protein, carbohydrates, fats, fiber, vitamins, and minerals. Do not focus solely on just one nutrient. So, how much energy is enough for a post-stroke body? The answer depends on each patient's constitution. For example, if the patient is obese, the energy portion will be less than that of a non-obese patient, calculated at about 25-30 kcal a day. If a patient is not obese, slightly thin, or has sequelae after the stroke, their muscle activity will be greater, leading to higher energy needs, potentially up to 35-40 kcal a day. As you may know, 1 gram of protein or carbohydrate is equivalent to 4 kcal, and 1 gram of fat is equivalent to 9 kcal. One important thing is that most stroke patients are older adults, and they are very sensitive to dehydration. If provided with adequate water, the patient will be more alert. The water requirement for older adults is about 30-40 milliliters a day. If the patient has a high fever, convulsions, or tremors in their hands or legs, water evaporation will increase, and you should adjust the water supply to the patient's body accordingly. The question arises: what foods need to be increased for post-stroke patients? Which foods should you prioritize to help them absorb nutrients more easily? An indispensable component is protein. In post-stroke patients, the protein requirement is usually 1.5 grams kilograms of body weight per day. Protein found in fish, chicken, or plant-based proteins such as beans, cow, legumes is very good. If these proteins are prepared thoroughly, the absorption capacity will be excellent for post-stroke patients. Next are vitamins, especially vitamin C and group B vitamins. Among group B, vitamin B12 is essential for the recovery of nerve cells. Vitamin B12 is found in marine fish such as sardines, salmon, tuna, herring, and mackerel. Additionally, beef, eggs, and milk are also rich in vitamin B12. Natural vitamin B12 is almost non-existent in plants, so you should use additional nutritional yeast or fortified nut milks, such as almond or oat milk with added B12. Components like glucides, carbohydrates, or fats can also be included in the menu. However, note that saturated fats, e.g. animal fats, lard, chicken fat, should be reduced. So, what should post-stroke patients limit in their daily nutritional menu? Stroke patients often have cardiovascular issues, so they need to limit overly salty foods. Typically, if the food is boiled, the patient may have it with a bit of soy sauce or fish sauce. However, if the food is braised or fried, minimize salt as much as possible and do not serve it with extra soy sauce or fish sauce. Besides this, during recovery, the habit of using alcohol, beer, or tobacco should be minimized as much as possible, as these are not good for the patient's condition. In general, whether it is an ischemic stroke or a hemorrhagic stroke, most cases relate to blood pressure or blood lipid issues, so the diet for these two types of stroke is similar. For patients with swallowing muscle disorders who can still swallow small amounts of food, they should still be fed orally. You should not give post-stroke patients thin liquid food. If the patient eats liquid food, they are more prone to choking. Therefore, processed food should be slightly viscous, thickened, and not too hard. And importantly, you should not change the consistency and state of the food. For patients with swallowing muscle disorders who choke excessively when eating, the doctor will place a tube from the nose to the stomach, nasogastric tube, to provide nutrients. In cases where the patient eats via a nasogastric tube, when feeding at home, pay attention to the amount of food administered through the tube. If the amount is too small, it will not provide enough nutrients for the patient. If the amount pumped in is too much, it will lead to reflux, causing the patient to choke on the food and causing aspiration pneumonia. This is a very severe complication for post-stroke patients. Patients should be fed the correct dosage recommended by the doctor when eating at home. Feeding too much, exceeding the doctor's recommendation, will easily cause reflux. The patient should be fed in a sitting position. Avoid feeding in a lying position as it easily causes reflux. If the post-stroke patient experiences bloating or indigestion, probiotics or digestive enzymes can be used to help digest food. These enzymes help break down food so the patient can absorb it more easily. Use drugs that increase intestinal motility, such as itopride, mozapride. These drugs help stimulate intestinal motility, making digestion easier for the patient. Pay attention to digestive issues. If the patient has prolonged diarrhea, they should be taken to the hospital for examination. Prolonged diarrhea leads to dehydration and electrolyte loss, which is very dangerous. In post-stroke patients, gastrointestinal bleeding can easily occur, with manifestations such as passing stools that are black or red. In this case, take the patient to the hospital for examination. Or in cases where food cannot be tolerated, causing abdominal distension and weight loss, the patient needs to go to the hospital for medical care.